question to you, Mr. Zappone. The old jail in the center of Litchfield is being sold by the state. Do our local state representatives have any role in how the property is disposed of?
I'll be frank in that question. Not currently being a state representative, I couldn't answer that question. There are certain areas in this debate tonight that we're going to have, or Craig Meyer's going to have a distinct advantage on me. That's because he's been in politics for the last 20 years. He's been serving in Hartford for the last 10. He's a career politician. That comes with some knowledge, sure, about the ins and outs of a process like that. It also comes with enormous liabilities. Those liabilities are a hyper-partisan attitude that my opponent has, an attitude that is divisive and corrosive, certainly to our politics in Hartford and in Washington. It's the kind of divisiveness that's created by career politicians that is slowly hurting our businesses and our families. What I bring in is a new form of leadership. I'm a fresh voice. I have no stake in partisan games. My only interest is in creating a better Connecticut for the people in the state. I'm willing to work with anybody who has good ideas, and certainly we're going to need people with good ideas. We're going to need people with good intentions. Anyone who's, I have no dog in the fight when it comes to Republicans or Democrats. Whoever's in control of the legislature when I get there in January, I'll be happy and eager to engage and work with. That's a stark contrast from my opponent.
As to the jail, I think most people who live in the community know that it is a high-profile building that has had some pretty significant uses in the past. There were many, many years, hundreds of years, it was used as a correctional facility. I do think that a legislator can kind of pave the way for a dialogue between the community that is a historic district, national historic district in the state of Connecticut. It has been on the list of assets to be sold. It's something that I supported being sold. Now that the building has not been sold, I think we need to go to a different plan, which would involve the borough, the town, and the state sitting down to find out what's the best way to merchandise the building so that the next use actually benefits the community. We don't need a train wreck in the center of town in that building. If I could just spend a second trying to clear up the record. My opponent accused me of limiting health care for people in the corrections system. I'm not advocating limiting health care for people in the corrections system. My position is the taxpayer in the town of Litchfield has to pay for their health care at Charlotte-Hungerford when they break their leg. Someone in our corrections system, an inmate, ought to have to pay for his broken leg. That's not how it works in the state of Connecticut. And with regard to the very small obligation that my opponent thinks the state of Connecticut has for post-employment liabilities, it's $56 billion, not $5 or $6 billion. And so that's the kind of hole that we've dug here in the state of Connecticut under a supermajority of Democrats. And I'm not super political, but in this case, I think we need to make sure that people know how the problem got created. The legislature, under the supermajority, underfunded the pension last year and the year before by $200 more million. So if we're going to start talking about facts, let's stick to the facts.
Mr. Meyer, are you a supporter of Sustanet? How would you improve health care in Connecticut? Can you do that in 2 minutes?
Well, I think there's going to be a process ongoing. I was here for part of the debate earlier, and certainly there's a lot of discussion about the federal health care plan as it currently exists. I participated in a number of conversations about how the state's current health care program, whether it's Sustanet or whether it's Husky or whether it's Medicaid, how those are going to interface with the new federal health care plan. Not knowing what's going to happen in the next year or two at the federal level, I can only say that I think we need to really catch up to what seems to be a runaway train at this point. The changes in the federal law in terms of health care have really changed the state's role in terms of providing health insurance, both on the Husky level, the Medicaid level, Sustanet, and the like. And I will be interested to see how those mesh as we go forward. I think listening to the conversation before and listening to some earlier conversations in Hartford, I don't think anybody knows exactly how all that insurance legislation is going to meld, but I do support the state of Connecticut working in concert with the federal government in trying to make sure that we don't leave people that were intended to be picked up on the street without health care, And at the same time, we don't burden somebody that we didn't think we were going to burden. It's my understanding that the state of Connecticut, under the current law, is going to get stuck with some obligations that it didn't have before the federal program was put in place. And so I don't know how that's going to mesh with Sustanet, Husky, and the federal law.
Craig is right. You have to look at Sustanet and how it's going to match up with the recent federal legislation. But let me say, as I've been going door to door, and I've had having forums throughout the community, I've been talking a lot about setting a plan for Connecticut, and that's making Connecticut a bastion for small business. And I believe that making sure that we have affordable health care in the state can be a differentiator for us, can separate us from the rest of the country and the rest of the world, and be a reason why people come here to start businesses. Currently, we have a lot of people that leave our state. I know people I went to college with, many of them have had to leave Connecticut to find employment elsewhere. Connecticut has to stop that cycle. We have to become a place that people come to for opportunity. And making sure that we have affordable health care is a way that we can do that. As far as the specific legislation, I would be in favor of anything that you could prove to me would lower health care costs across the board for people. So if that can be done through Sustanet in accordance with recent federal legislation, then I would be in favor of that. If somebody came up with a new plan that said this is going to lower people's health care costs, then I would be in favor of that. I'll tell you right now we have a problem in that programs that we currently have, like Husky, are too expensive for most people to operate with it. Health care is at a critical mass, not just in Connecticut, but in this country. And we have a responsibility to make sure that we can provide for the people of our community. And we have an opportunity, if we're forward-thinking, to set ourselves up to take advantage of low health care costs to entice business